The Rotary Central TTK VHS Blood Bank is a project of the Rotary Club of Madras Central, and it was set up with a 3H grant of US dollars 275,000 in the year 1996. This is a project of the Rotary Club of Madras Central. The objectives of the blood bank are to provide high quality, safe blood and blood components at an affordable cost to the poor, and when they are abjectly poor, it is given totally free of cost. The blood bank is a not for profit organization. The blood bank also provides free blood and blood components to the most needy. The service of the blood bank is available round the clock. There are technicians who work in 3 shifts around the clock. Presently, the blood bank collects and distributes around 1,500 to 2,000 units of blood every month. The blood bank is equipped with state-of-the-art facilities. State-of-the-art equipment like cell separators are used for testing the blood and for making blood components. The purity, safety, and efficacy of the blood components conform to international standards. We have adequate infrastructure to supply blood and blood components to all clinics, surgeons, and hospitals in the city. Apart from the whole blood, the components available are packed red cells, group-specific fresh frozen plasma, platelet concentrate, and cryoprecipitate. Whole blood or blood components will be issued against written requisition from the concerned doctors or surgeon to the blood bank officer, along with 5 milliliter sample of the patient's blood. Let me now ask and answer some of the most commonly asked questions with respect to blood donation. Let's start with the first question. Who can give blood? Any healthy person of either sex between the ages of 18 to 60 can give blood. The volunteer should not weigh less than 50 kilograms. How often can a person give blood? A healthy person can safely give blood once in 3 months. He is medically examined, including a blood test, to ensure that he is fit to give blood. In practice, the number of times is limited to 2 or 3 donations a year, so as not to inconvenience the volunteer too frequently. There are many donors in Madras who are given blood approximately every 3 months for several years. If a small percentage of an able-bodied adult in the population gives blood once a year, there will be more blood than the hospitals will ever need. Will it hurt when blood is collected? The answer is only slightly. There will be a momentary pain when the needle is inserted. Thereafter, there will be no pain whatsoever. Will there be any ill effects after giving blood? None at all. As mentioned earlier, every volunteer is medically examined before each donation, and only those who are found fit are allowed to give blood. Have any specific precautions to be taken after giving blood? Nothing at all. The donor can attend his normal work as usual. However, as a safe precaution, donors with some special occupations such as bus drivers, train drivers, airline pilots, persons like masons who have to climb ladders, etc., are advised to rest for half a day. Is there any special treatment, diet, or medicines required after blood donation? No specific treatment is called for. The amount of blood given by the volunteer is well within his normal reserve capacity, and his body recoups it quickly and without his own knowledge within 24 hours. How long can the donated blood be preserved after collection? The answer is it can be preserved under refrigeration and used up to 5 weeks. However, the demand is so great at present that all the available blood is generally used up before time expiry. Occasionally, when there is a surplus, it is processed into components, namely plasma, which is an excellent substitute for emergency treatment of bleeding and for burns. Is there any chance for the donors being exposed to serious transmittable diseases like AIDS and jaundice through blood donation? The answer is a definite no. All materials used for blood collections are sterile and disposable. All care is taken to use disposable syringes, needles, and blood collection bags, and believe me, it is 100% safe to donate blood. Please encourage Rotarians and particularly Rotaractors of your club to donate blood. Please believe me when I say this, the Rotaractors are our major resource for blood donation. By making them donate blood, we are not only getting their blood, but at a very young and impressionable age, we are also inculcating in their mind a sense of service. For arranging blood donation camps, please contact Dr. J. Balasubramaniam, Director of the Blood Bank, at 22542829. The blood bank doctors will bring all the necessary equipment for the blood donation camp. The club organizing the camp need to provide a place like a classroom in school or college for bleeding the donors. The club also should ensure that a minimum of 25 donors are available. The blood bank will provide a blood donor card with the name and blood group of each donor. This card can be kept in the wallet and may be useful to the donor in the event of an emergency for him or her. For your requirements of blood, please contact the blood bank directly.